So as you know, those of you that have been here to our seminar series before know, we love featuring a recovery community center leader, administrator, someone who is on the ground and making a difference in folks' lives through their leadership at recovery community centers. And today we have Javier Alegre, who's the executive director for the Latino Behavioral Health Service. And Javier, I'll hand it over to you and you tell the folks more about what you do in your organization.
Thank you, Brandon. I just got a little quick pop-up message saying my internet connection is unstable, so hopefully you all can hear me well.
Yeah, you're good. Okay,
thank you. So I'm very excited to be here and get to share a little bit about who we are and what we do in Utah. Latino Behavioral Health Services is a nonprofit organization. It's a CBO, community-based organization. It's an RCO, recovery community organization. And we run an RCC, which is called Jackie's Place. Let me explain. Jackie is our founding mother. She is the person, the force behind our existence today. And she passed away about 6 years ago. So we opened up this, we name our recovery community center after her in her honor. So let me explain. The name tells you a lot. Excuse me. Our primary focus is the Latino and Hispanic community, even though we work with a lot of multicultural and multi-race individual, especially youth. Our services are not only language specific, but also culturally responsive. In our RCC, when a person walks into the door, they will find a wall of art and maps representing all of the countries that we serve, and not only serve, but all of the individuals that work at Latino Behavioral and their countries. We have over 13 countries represented in our staff. So chances are you will find someone from your country of origin when you walk through the doors. Our space is not only designed to feel homey and welcoming, but it's also designed to integrate the participants into their life experience that our staff has. So our spaces are open, our spaces are integrated. So when a participant comes in, whether it's to use the phone, get some coffee, or hang out and sit in a space where they can feel safe and they can feel comfortable, they are most likely going to run into a staff member. A staff member is going to have the opportunity to check in with them, casually talk to them, offer them additional support. Sometimes we just want to sit and be alone with our thoughts, and that's perfectly fine. But if you need, or the participant needs additional support, we're happy to provide it, and we will make multiple efforts to offer it without feeling too pushy. Latino Behavioral Health Recovery Community Center offers not only peer support services, supportive groups, psychoeducational classes, social activities, skill building, et cetera, like many of us do. In our recovery community centers, we also have a clinical component to it. So we have sort of modified the traditional model of peer support and clinical services and integrated them both together. So persons that come into our RCC have the opportunity not only to receive the benefits of a peer support specialist, which is our primary. Over 75% to 80% of our services are peer support. And only about 10 to 15% are clinical services. But they do have the opportunity also to receive those services and combine them. So our model primarily or specifically or ideally would incorporate clinical services plus peer support plus supportive activities and skill building and psychoeducational classes to ensure that the participant has a wealth and a wraparound sort of support system that would allow them not only to work on their mental well-being, but also their social skills and the social connectedness to our services. One of the things that we really strive to do is to make sure that everyone that walks through the door feels like they belong and feel like they are a part of our agency or our recovery community center. And I think by integrating the spaces and opening up the spaces and speaking the language, the music, the colors, the paints, the art, everything that creates this space, it's culturally responsive and language specific. And one of the ways we do that is by allowing our team members, which come from more than 13 different countries, to bring that to the spaces. So we all contribute and collaborate in creating areas where our countries are represented, where our traditions and our beliefs are represented. And have the opportunity for those that come to seek services, volunteer, or support us to also bring their own cultures and their own traditions and beliefs into the space so they can have the opportunity to feel as though they are a part of it as well. I think that summarizes, our intent, like many of us do in RCCs, is to ensure the participants feel welcome, feel acknowledged, heard, and safe in a space where they can comfortably ask and seek help if they so choose to. I think that's all I have.
Right.